Now, there are other blood pressure medications to consider. Earlier I've mentioned the angiotensin receptor blockers such as Losaratan. You've also got the class of beta blockers, which are your Atenolol, your bisoprolol, and another drug called propranolol, which is actually also used for migraines and anxiety. Then in addition to indapamide, you've also got other group of diuretic agents such as your benzoylflumethiazide, spironolactones, which is usually used for resistant high blood pressure. So in most cases, if you're on amlodipine, you're on ramipril, you're on Losartan or a beta blocker such as bisoprolol, you might end up being on a fourth medication such as spironolactone, because this usually indicates that your hypertension is resistant to medication. And spironolactone has its own side effects as it increases the levels of potassium in your system. Another diuretic is furosemide. Furosemide is a water tablet that is also used in conditions such as heart failure, as well as swelling of the legs for other causes. And one old school medication that used to be used for blood pressure is called clonidine. Now, clonidine is now used for hot flushes or night sweats in women who suffer from menopause symptoms. So these are my top 3 medications for reducing blood pressure: amlodipine, ramipril, and indapamide. Now, a common side effects to these blood pressure medications that I've mentioned, as well as a lot of all the other blood pressure medications, is erectile dysfunction in men, which means as a man, if you're going on blood pressure tablets, you're more likely to have weaker erections or erections that are not strong enough or last long enough to sustain satisfactory sexual intercourse. But you have to balance the benefits against the risks, because high blood pressure is also known to cause erectile dysfunction, and you can argue that the longer you have high blood pressure, the more likely it is to have permanent damage to the blood vessels that are responsible for causing erection. So by being on these medications, you are actually preventing long-term damage to the blood vessels, which are the veins and the arteries of the penis. So if you have a side effect with erectile dysfunction from one of the blood pressure medications, your GP might consider switching you to a different alternative blood pressure medication that is less likely to cause that side effect.